and thank you for joining another Heart for PCOS series. Today we have an amazing guest that I am so excited to be able to sit down with, Dr. Sophia Yen from Pandia Health. Dr. Sophia Yen is board certified adolescent medicine with 20 years of experience in medicine. She graduated from MIT, UCSF Medical School, and UC Berkeley with an MPH in maternal child health. Dr. Yen co-founded and is the CEO of Pandia Health and enjoys educating the public and other physicians about birth control, acne, weight management, and other adolescent health issues. She has been featured in many publications for her work in reproductive health. And as CEO of Pandia Health, welcome, Dr. Yen. And thank you for sitting down and spending a little bit of time with me today to talk about PCOS, adolescent health, and cardiovascular risks, which I know in adolescence, we don't normally think about that, but there's some good information that we can cover and help people understand why it's important to start learning about PCOS and heart health at younger ages. So before we dive into some of the questions I have about birth control, I want to talk about one of the reasons that we may need to use it, which revolves around our menstrual cycle. And particularly with PCOS, we're experiencing irregular periods. I know one of the things that you have been trying to change is the stigma that surrounds periods and birth control. And often we can't get healthy or fix problems if our providers don't know we have them. So why is it important to talk about our periods?
So I have a colleague, Dr. Paula Hillard, and she's a pediatric adolescent gynecologist at Stanford, and currently I think the editor of NASPAG, North American Society of Pediatric Adolescent Gynecology's journal. And as many people will tell you, your period is a vital sign. You have your heart rate, your blood pressure, your temperature, and then the last one is your period. Though I am a proponent of hashtag periods optional, which is don't have a period unless you're trying to make a baby, in which case then it isn't as relevant because you're not having any periods and there's nothing to report. But it is really important for people of reproductive age and their providers to note, are you having periods? Are you not having periods? And to give people that choice of having a period every month or not having a period every month. And for those bleeding monthly with a uterus, I say, that is so 2020. Get with the times, talk to your doctor, consider making hashtag periods optional, especially those with PCOS. It might help decrease the risk of cyst formation and ovarian torsion from a cyst formation.
Right. So for patients who have PCOS, about 90 to 95% usually wind up having irregular periods. So what might an irregular period look like? No cycles, heavy bleeding, cycles, more than 35 days apart? What are we looking for with PCOS?
So usually with PCOS, what happens in a normal cycle is you have 4 or 5 different eggs all growing, and then whoever gets the most estrogen wins and then pops out. And then once it pops out, it starts to create progesterone. And then if a baby doesn't happen, then it goes away, and the progesterone drop is what triggers your period. But if you don't have any eggs popping out, and that's what's happening with PCOS, the eggs try to, but then they don't pop out, and then they get the ovary bigger and bigger and bigger. It has all these little cysts in it, and we call it a strand of pearls, on ultrasound that we see. Then you don't have the egg popping, you don't have the progesterone, you don't have the progesterone falling, and you don't have the lining coming out. And so the lining builds, and you have a risk of endometrial cancer. So it's really important, if you're not on any hormones, that you should have a period every single month after you're outside the first 2 years after your first period. Because I'm an adolescent medicine specialist, and I put up a YouTube video, 5 reasons why your period is late. And I forgot to put in there, if you just started your periods, they can be totally whack for the first 2 years. And all these 12-year-olds are on my YouTube like, well, I'm 12 and I haven't got my period. And I was like, okay. Within the first 2 years of your period, it can be totally whack. But if it has been coming every single month and all of a sudden it goes away longer than 3 months, then that is of concern. If it's longer than other people's, that's fine, because it can vary from every 28 days from your first bleed to your next bleed. or it could be up to 35 days or even 45 days, but greater than 3 months is not normal and puts you at risk for endometrial cancer. However, with hashtag periods optional, using hormonal therapy such as the IUD, the implant or shot, the pill, patch, or ring, you can make hashtag periods optional. And that's fine because there's progesterone in all of those methods. And so they're stopping the lining from growing. The lining, I like to explain it as, instead of growing to a level 10, rich, full with blood, waiting to grow an embryo for 9 months, it's just at level 1. And so it's not like growing. It's just 1. And then you can choose to bleed every 3 months, every 6 months, or never. I haven't bled for the past 13 years since my last child, as long as I take my medicines. So it's kind of awesome.
So then if you are taking medications that are controlling it, then totally fine to not have a period. But if you're not on anything and naturally you're not having a period, not so great, right?
Yes, and that's the complicated part, because we tell PCOS patients, we're putting you on birth control because your periods are irregular. I'm going to make them regular. But actually, it's just, we don't want that uncontrolled growth with, we call it unopposed estrogen, with no progesterone. But if you have estrogen and progesterone, then it's not uncontrolled growth. It's just, and so just like level 1. And so it's a hard concept. It's complicated, but bottom line is, if you're not on any hormones and you're 2 years after your first period and you normally have a period every month or so, goes away for 3 months, please see a doctor, because it could be an eating disorder, it could be a thyroid problem, it could be polycystic ovary syndrome. But if you're on the pill, patch, ring, IUD, implant, or shot, then your periods can come whenever they want to come. It's not that important because you're getting progesterone.
And I love that. I love that we actually have options, that we don't have to, like you said, that we don't have to have a period if we don't want to, as long as it's controlled and somebody's watching over us and making sure everything is going the way it's supposed to go. We don't have to deal with it. We can have PCOS or not have PCOS and have a period or not have a period. So that's great news for a lot of people who feel, especially with PCOS, when we go on the pills, that means you're going to have a period every single month. So I love that. Since this is February and Heart Month, I wanted to talk about PCOS and cardiovascular health. I want you to help me educate and bust some myths, and I know you love busting myths, so I can't wait for this, that I have seen regarding birth control and PCOS and cardiovascular disease, because we know that birth control pills and other types of hormonal birth control have become a first-line treatment for patients with PCOS. And there's also been a lot of controversy about using birth control pills, with some saying it only masks the symptoms. So can you talk a little bit about why birth control is used for PCOS and why it can be so effective in treating the symptoms?
I am a primary care physician for teens and young adults, but I'm also a consultant on my specialty, which is adolescent medicine, what we call sex, drugs, rock and roll. But in my primary care hat, I'm supposed to bring together the recommendations of the specialist and provide the best possible care for my patient. I'm here to coordinate. And because the joke in medicine is, if you're a surgeon, then the answer to everything is surgery. If you're an endocrinologist, then the answer to everything is endocrinology. And if you're an OB-GYN, the answer to everything is OB-GYN. So if you see an OB-GYN, they will tell you the first line treatment for PCOS is birth control pill, because that's what they're comfortable with. That's what they're focused on. Those are their concerns, preventing endometrial cancer. However, if you see an endocrinologist, their stuff is metabolism, insulin, diabetes, and even lipids, one could say, though people are saying that's, cardiology. And so I think if you ask the endocrinologist and or the cardiologist what a good treatment for PCOS is, certainly diet, lifestyle, but also metformin. And so I actually put together a national talk for the Society of Adolescent Health and Medicine. And we had the OB-GYN, who of course said birth control. Then we had adolescent medicine representing endocrinology, and they were like, metformin. And the research has shown that it's actually better the two together, because the metformin treats the metabolic things, such as high insulin, risk for diabetes, bad lipids and diet and that kind of stuff. And then the gynecologist side is just, I don't want uncontrolled growth in your uterus leading to endometrial cancer. I don't want cysts happening in your ovaries, and then you twist and then you lose your fertility. So each is focused on their own thing. But if it were me, my daughter, my friend, I would do both. And the research has actually shown if you do both, it's better because you're hitting both sides. The birth control only hits the hairiness and the risk for endometrial cancer and the risk for ovarian torsion and the irregular bleeding. And as I mentioned, the metformin only takes care of the metabolic part and doesn't take care of the zits and doesn't necessarily take care of the increase in the endometrial lining and the risk for ovarian torsion.
So when somebody comes to Pandia Health, they can kind of get that advice and get both if they need it, correct?
In the future, right now, we're just doing birth control. We are here to make sure no one has to suffer from what I call pill anxiety. I actually coined the term, never coined before in medicine, but once you hear it, you're like, oh, yes, right? You get to that last week, and if you don't get to the pharmacy, there will be a dire consequence, right? And those of us who've had to use the pill, the patch, the ring, you know, have suffered from pill anxiety, and we will suffer until we're hit menopause for 30 years of our life. And I'm all about hashtags. So hashtag better things to do, you know, and that's why I created Pandia Health, so that nobody runs out of birth control, pill, patch, ring on our watch, to the best of our ability to bring expert doctor, women's healthcare, evidence-based, cutting edge to wherever you have internet and a mailbox.
And I love that because I know for me in particular, especially when I was a teen dealing with PCOS, I had a lot of anxiety, not just pill anxiety, but anxiety about going to see the OBGYN, because every time I went, I was like, oh my God, I'm going to have another exam before they give me more pills, blah, 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 blah. So this makes things a lot easier and a lot more accessible for a lot of people, which is awesome. And I think a great introduction for, you know, younger women who are looking to try birth control. So if you take the pill or other types of birth control that have hormones and you're young, healthy, mindful, can you feel comfortable that it is safe with PCOS?
It is absolutely safe, except if you have any blood clotty tendencies. So if you have a family history of protein S or protein C deficiency, that means you have a risk of a blood clot. So if anybody in your family has that, you should get checked and see if you have that risk. And if you have that risk, then estrogen containing birth control pill, patch, ring is not for you. But you can use the IUD, the implant, or the shot. Those are progesterone only and don't have the same blood clotting risks. If you have lupus with these specific antibodies, antiphospholipid antibodies, again, you're more likely to clot. If you have breast cancer or liver cancer, the birth control pills, again, can aggravate that situation. If you have none of those, which 95% of us don't, then the risk of birth control pills is maybe a slight risk in breast cancer, but the risk that it brings you is the same as if you drink 3 to 5 alcoholic drinks a week. So for those of us that are 21 or above, applicable, but maybe not applicable because maybe nobody drinks that much, but some people do. So it's all about relative risk, but the decreased risk of ovarian, endometrial, colorectal cancer, and anemia from being on the birth control pill, patch, or ring is greater. The decreased risk is greater than the slight increased risk of breast cancer. So I know that breast cancer is on everybody's minds, but actually, as you're bringing out this February, and we're here to talk about today, women's risk of dying from cardiovascular is much greater than women's risk of breast cancer. It just scares us because breast cancer is unique, and the cardiovascular women's heart attacks have been dismissed as, oh, it's in her head, or blah, 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 because it's different from what doctors have been taught. And I realize, you know, as a physician coming to you, everything in medicine is based on the 70-kilogram white male, of which all of us with uteruses are not. And those of us who are of color are not, you know, so That's why women's health has been neglected, because we aren't the typical standard for medicine. And I do want to say, people are all angry and stuff, but I get it from the science side, is that it's a lot easier to do an experiment when everything's the same than if you have women who are hormones up and down, and they could get pregnant and they could sue you. So you don't want to do research on anything like that,
Right, right.
And that's why.
Yeah, no, it's unfortunate because PCOS in particular covers such a diverse group of individuals. And I think we are kind of missing the mark and doing a disservice to this community in particular when we're not exploring all of that. So thank you very much for bringing that up. It's very important. So can we talk about how not all birth control is the same and is dependent on the individual, their health profile, and their goals? In particular, like the difference in progestin, estrogen, estradiol, which I know you touched on a little bit, but if you could give us a little more information on that, I would love people to learn.
Yes. What distinguishes Pandia Health from other companies out there is we are the only academic doctor-led company in this field. And I've realized I've spent the past 6 years only doing birth control. Other people have been doing COVID, runny nose, your general health stuff. All I've done is the birth control pill. There isn't that much variety in the patch or the ring, though there are 2 options for each now. And on the patch side, we prefer Twirla over the old stuff because it has lower estrogen and therefore decreased risk of blood clot. And then on the ring side, both of them have low estrogen, but the new 1-year one, if you're 30 and above and have PCOS, go for it. But if you're under 30, we don't recommend less than 30 micrograms of estrogen in whatever method you're using in the pill patch ring, because it's shown it's not good for your bone density. And particularly Asians, Latinos, Blacks, people who aren't good with their calcium because of lactose intolerance, or culturally, we don't drink that much milk, then you need the best bones possible. But if you're heavier and have strong bones already, then maybe not an issue. But if you're scrawny and don't have enough calcium, or, et cetera, then just in general, I would recommend 30 micrograms of estrogen until you're 30 years old. And then realizing what I was taught at the major academic institutions works great if you're a Caucasian female that wants to bleed every month. But if you're Asian, Black, or don't want to bleed every month, then I actually took all 40 different birth control pills, ranked them from most likely to make you bleed, least likely to make you bleed, most likely to give you munchies, least likely to give you munchies, most likely to give you zits, least likely to give you zits, and optimized it. And so if you're a Caucasian female that wants to bleed every month, okay, we'll try the one that we were always taught to give. But as an Asian, Black, or somebody who doesn't want to bleed every month, let's go with this one. And we found 82% retention for newbies on birth control versus the standard 55. Because if I give you something, you have breakthrough bleeding, you get zits, you get munchies, you're like, out of here.
Right.
I tried the pill, it sucked, and it's like, no, there's actually 40 different pills, or at least 8 different progesterones. So please, please, please note, when you don't like a pill, what's the progesterone? What's the dosage? Because there's also 2 levels, and one is 30 micrograms, one is 1 and one is 1.5, or sometimes it moves around. And so that's like, 1.5 to 1, it doesn't sound like much, but it's 30% more. So if I put it down by 30%, you may not have that side effect. But also know, if you don't like this progesterone, there's 7 other progesterones. And for the PCOS patients out there, the best one to decrease zits is drospirenone, zits and hairiness. But as an adolescent medicine provider, we like to make sure people can drink 8 glasses of water with it. Because if you're the kind of person who's like, bathroom at school is nasty, I don't have time to go pee during school, and you don't drink it, and then you take this pill and you're like, I have this headache. And ever since I started this pill, I don't know. And you don't connect the 2. And I asked the patient, well, are you on the drospirenone? And they're like, yeah. And I was like, do you drink 8 glasses of water? No. And I was like, there's your headache. Like, drop the drospirenone or drink more water. Those are your 2 options. So that's the difference between a doctor who knows their stuff and is concentrated and focused on a particular field. I love general practitioners, but if it were me, my friend, my daughter, my patient, I want the best and the brightest. And that's why MIT, UCSF, Stanford, brain focusing making the spreadsheet and teaching all of our doctors how. If you get side effects, you're like, you got munchies, like, okay, let's turn this down. You got breakthrough bleeding, let's turn this up. You got zits, let's turn this down. But no, this is my one pet peeve. They're like, well, my libido is down, and something about zits, but the two are different sides. Either I turn down your zits and your libido drops a little, or I turn up your libido, but then you're going to get some zits.
I'm absolutely blown away because I had no idea there were so many options for birth control. And it seems like depending on where somebody is in their health journey, there's something that you can find for everyone. So that is a great option. And to have someone like yourself looking at all those options and like, hey, I'm all for less munchies, higher libido, and everything else. So definitely some great options here. So I wanted to talk a little bit more about cardiovascular health for heart for PCOS and birth control. So does being on birth control long-term or in older women create more risk for heart disease? And if so, are there ways to reduce the risks, or are there other options?
I would say being on birth control doesn't increase your risk of heart disease, in that it's not. Some of them may give you bad lipids, but it hasn't been, the newer ones don't. It's the ones I call that have more manly side effects. And so the original progesterones had these manly side effects, which was zits, but then you got libido, but then you got hairiness, but then your lipids were bad. And so the newer ones are the flip. Your libido's down some, you don't have zits, you don't have hairiness, and it doesn't affect your cholesterol as much. That's a progesterone. The estrogen, we used to start with 120 micrograms, and now we're at 30. So we're at 1/4 the original dose. And then I think the concern comes with menopause. So when you hit 50 years old, the Women's Health Initiative, which is the largest menopause study ever, showed that if you start hormonal therapy, hormonal replacement at 63 and above, then you have an increased risk of heart attack because estrogen is blood clotting. And my theory there is you're 50 and you lose all your estrogen, then the benefit of estrogen for women is it actually makes our arteries more supple and less blood clots. You take that away, turn us into men for 10 years, and then you get blood clots and hard things. And then you throw estrogen on it, then of course you're going to get blood clots and heart attack. And so we've since learned, since that large study, which will never be repeated because it was so crazy expensive, but really somebody rich should fund it or we should do it, that we have to start hormone replacement before 60. So if you're between 50 and 60, you want to start your estrogen before 60, because once you're 60, we've turned you into a man, and then we put back estrogen, you're going to get blood clots and die. So you're not going to die, but you have a high risk of blood clots and die. I'm always like, die, to emphasize how bad the situation can be. Don't take this lightly. So never lie on health questionnaires, because doctors, we just want to make sure you don't die and you don't have the interaction. Don't hide any drugs. Don't withhold any information because you could die. But with respect to cardiac health, I think if you're on the newer birth control pills, the standard dose, there isn't any increased cardiac risk that I've heard of. If you're 50 and above, menopause, hormone replacement therapy, you got to take that in consideration with respect with your cholesterol and all that stuff. And if you're 60 and above, they don't recommend it because it's too late. So you need to start it before then.
Can you give a recommendation for younger women and teens as to why it's so important to take care of your health starting at an earlier age?
Everything is easier when you prevent it. And that's why I chose adolescent medicine. When I went into medicine, you have to choose what field you want to do. And it was internal medicine, which is, 20 and above till you die. And then there was under. And when I was working at the VA, these people had lung cancer, they had liver cancer, and it was all from habits that they had, developed. The liver cancer was drinking, the lung cancer was smoking. And it was just sad you got cancer, now I got to deal with this. Whereas with teenagers, we can grab them right when you start, and you can have sex, but you don't have to get disease and you don't have to get pregnant. And you can drink, but in moderation. Don't go get liver cancer. Don't go kill yourself. Don't do drugs in general. A lot of people are self-treating. Go see a therapist and get legal drugs like antidepressants and ADHD meds and whatever it is you need. Don't be like anxious and then take marijuana, and mainly because it's illegal and it's going to go on your record, but also they've shown it affects your brain. So I don't recommend marijuana until 30, 35 when your brain's done growing, because they've shown that it actually blocks the growth of the brain. So I would say, if you're having irregular periods, if you're having hairiness and acne, part of that is teenagery, but when your periods go away for 3 months or more, probably polycystic ovarian syndrome. Also, the doctor can check a quick free testosterone, sex hormone binding globulin, and then just rule out other bad stuff just to check. And if that's abnormally high, then maybe more PCOS, and start taking care of your health from the diet, exercise, so that you don't have to go on metformin. And I think the future will be probably GLP-1, if that's the new hot thing. It's an injection once a week, and I call it metformin 2.0, even stronger. But it's crazy expensive. I realize it's $50 a day, and our healthcare system can't afford that. Hopefully that we can make more of it and make it cheaper, but drug companies are going to milk it for all it's worth. And if we all go on GLP-1, then it will destroy our healthcare system.
Pretty much. And we don't want that to happen because it's already in chaos. So
exactly.
Let's not do that, gang.
We can't afford that.
No. So I want you to tell everyone a little bit more about Pandia Health and what you do and how it's helping people get the care that they need.
As I mentioned, Pandia Health is the only doctor-led, women-founded, and women-led birth control delivery. Co-founded it with 5 other people, a total of 6, 5 of us being women, 1 being the CTO. And because I want to make sure we had all the components necessary to make it an amazing product. A doctor covering the doctor stuff, a pharmacist covering the pharmacist stuff, though eventually she left because she needed money and we couldn't afford her when we only had 10 customers. So, but all the kind of pieces there. And the goal of Pandia Health, we're starting with birth control. We're adding acne, and then we're going to add menopause, because I'm of menopause age and all my friends like menopause. And I'm like, yes. And it's the same medication as birth control, but just a lower dose. And so the contraindications are the same. It's very easy and the doctors feel comfortable. And then we're going to throw on PCOS. Right now, PCOS we're treating just by taking care of your birth control pill, patch, ring. But in the future, we can add on metformin. And then obesity, because that's a specialty of mine as well. And then yeast infection. So we want to be the online health brand women trust. If you have a prescription and insurance, sign up, tell us where your prescription's at, or ask your doctor to send it directly to our pharmacy. You pay us nothing, because thanks to the Affordable Care Act, the birth control pill, patch, ring, any FDA approved birth control, even if you're not using it for birth control, but using it for PCOS, is no copay, no deductible. If you are paying any copay or deductible, please contact coverher.org. It's a National Women's Law Center nonprofit. They'll tell you how to yell at your insurance, and hopefully they're collecting cases and will sue all the insurances, because I know a lot of them are not doing that. And by law, they should, unless they're Hobby Lobby or religiously exempt. Unfortunately, the Jesuit colleges, I always forget, Georgetown, USC, doesn't sound religious, but they're Jesuit colleges, so they don't cover it, which is stupid and makes no sense. But anyway. And then if you need a doctor, then you can use our expert birth control doctors that have been trained on our algorithm with 82% retention. Part of that, I think, is also our great customer service. $25 once a year to use our expert birth control doctors to help you find the best birth control pill, patch, or ring for you. But if you like the one you're on, we'll just keep you on it unless it's too low of estrogen. Then we'll be like, you maybe should go up a little because your bone density, And then you just fill out a questionnaire, give us a blood pressure. You can either just call up your doctor, go to the pharmacy, go to the grocery. The one I like is Fire Station, hot fire people, but go there and stay calm for 5 minutes, because we don't want your heart rate or blood pressure artificially elevated by hot fire person. And get your blood pressure and say, my doctor told me you'll get it, and they got nothing to do. Well, they have important things, but when they're sitting around waiting for that important thing, they are EMT trained and they can do it as a public service. And then you fill out the questionnaire, give it to us. We send it to our expert doctors. Our doctors write the prescription, send it to our partner pharmacy. And then you look behind us. Every package comes with 3 months if we can, 6 months, a year, depending on your insurance. If your doctor only wrote for 1 refill times 12, time to educate your doctor. Please write for 13 packs or 17 packs if you're skipping the bleeding week. And then we can always constrict the prescription, any pharmacist, but pharmacists cannot expand the prescription. So that's a lesson for you to teach your doctor, because I never realized that until I started this company. Yeah. I'm like, I wrote you dispense 1 refill times 12. What are you complaining about? I actually change you to that pharmacy every single month. And then our default is high chew, but during the holidays, we had extras in there that are free, and we're always promoting women-founded, women-led, positive, companies for women in there. And then you see a little postcard. We call that the Pandia PSA, public service announcement, with a tidbit like, did you know your birth control should not give you munchies, and that it should not give you zids? And if you do, please talk to your doctor. Or did you know you can make #periods optional? Or did you know that Plan B is not good if your BMI is greater than 26 and doesn't work at all if your BMI is 30 or greater? And so Pandia Health, we recommend Ella, the prescription emergency contraception. And everybody that gets birth control, like, you want some Ella with that in case you forget, or in case your friend, needs it or whatever. Though legally you didn't hear me say that.
No, not at all. But I have one really huge question for you. Where have you been all my life?
We have been around the past 6 years. So I hope anybody who's on the birth control pill patch ring, please use us. You pay us nothing if you have a prescription and insurance to cover it. We take almost all insurances. We're working on getting Medicaid in all the states we're in. We can deliver to all 50 states, and we can write the prescription in 15, which covers 85% of the population. So if we're not in a state where you are, if you can get to a state, and that's why we chose the most populous states that you might vacation to. So California, Florida, Texas, New York, Illinois, Pennsylvania, Georgia. All you got to do is get there once a year, fill out the questionnaire and say, I am right now in Georgia. I am right now in New York. I am right now in California. Pay the $25, and then we can ship to all 50 states. And you just got to get back to that state once a year and be like, I'm back in New York. I'm filling it out. We will be expanding to as many states as possible, but it's about, we're raising money to expand our company. So anybody who can write big checks, come our way. Feel free to introduce yourselves. We also have a Pandia Health Birth Control Fund. It's a nonprofit that if you want tax deduction, or if you can't afford to pay for your birth control or the $25 telemedicine, you can apply. And we give out as much as we get in. I haven't been really good at fundraising, so right now I don't think we have that much money there. But feel free to donate. Feel free to ask if you need help. And we hope it's a pay it forward, or give a penny, take a penny, that kind of thing.
Absolutely. No, I love that. And thank you so much for doing that, because it's important that everybody has accessibility to healthcare and to birth control and to reproductive health options. So important. So I have one final question to ask you that I ask everyone that I interview, which is, since you've been such a strong supporter of the PCOS community, I want to know why you feel it's so important to raise awareness for PCOS and to join campaigns like Heart for PCOS.
Well, 1 in 10 people with uteri will get PCOS in their lives. And another hashtag of mine is #stop sucking it up. So we should let people know about our bad, evil periods. We should let people know about our health conditions. Though, again, it's your choice if you want to keep it private. But I like free pity, like in a help me out kind of way, like I have zits and it's hormonal and I'm going to use medicine. I'm going to get treatment. I have a health concern. There is a health concern that affects 1 in 10 of us with uteri, and therefore there should be money going towards that for research and for treatment and to help people that can't afford it, because it increases their risk of cancer, and it also affects their quality of life and heart attacks and all of that stuff. So it's important to care about others, and it's important to care about something that affects 1 in 10 people with uteri.
Absolutely. So finally, can you please tell everyone how they can find you through your website and social media so they can learn more and they can sign up to get their pills in the mail?
Yes. So please go to pandiahealth.com, PANDIA health.com. And the way to remember Pandia is, one, we chose her because she's the Greek goddess of healing, light, full moon. So we're all about women's empowerment and goddesses. But a way to remember the spelling is Pan is every and Dia is day. So we want to take care of you every day. We want you to have Pandia peace of mind, Pandia Zen. We are on all the socials. So TikTok, Insta, Facebook, LinkedIn, YouTube, all that, all under Pandia Health. So check us out. And we've set up a code PCOS GURL, GURL, that if you enter that, you get $5 off once a year telemedicine visit, hopefully just once a year, because we'd like to make some money. And it's a total steal at $25 once a year. The price probably will eventually go up, because to see me at an academic institution would probably cost you $250 to $750. So $25 is a steal.
Awesome. And thank you for the code. And I hope that all of you will take advantage of that, because this is a great opportunity, a great company, and just a great human being. Thank you, Dr. Yen, for sitting down with me this afternoon and spending some time explaining birth control and how it's all connected to cardiometabolic health, to cardiovascular health, and to adolescent health. So important. And I hope all of you will continue to follow and to tune in for more Heart for PCOS interviews, live events, giveaways. Oh my gosh, we have a full month. So thank you for joining us this afternoon, and we'll see you again soon.